Okay, here we are at a closer view. Remember, in the beginning, all we did was start with a little bit of cream, palm of the hand, rub it together, apply your cream or your lotion or your coconut oil, jojoba oil, whatever people are using these days. Just be careful. It might not be what the athlete wants. Just use regular plain cream lotion or cream. With no additives, don't have anything smelling, aromatherapy. It might have an allergic reaction to the athlete. So now that the leg is nice and lubricated up, how's the thumb stripping? Remember both of those thumbs like a little bird or a bat? Right here at the kneecap. Your patella is here, patella tendon is here. So remember the tendon attaches to the bone, which is the patella bone. So not on the bone, do not put your fingers here. Go right where the tendon is, where it dips down. Then see how the knee buckles? Don't worry about that. It's going to go underneath your thumbs. Just go slow. You do not go fast. And see how the skin finally loosens up and goes underneath your thumbs. And you start to really feel her tendons and the muscle underneath your thumbs if you press that hard. So let's strip again. See how red my thumbs are? See the white and then the redness? That means I'm using pressure. So see how it goes back to normal? I press in. You see the white tips on my thumbs. Because I'm using pressure, pushing out the blood of my fingernails. So remember, we're not doing petrissage or fluff and buff and all that other good stuff. So remember, we're doing our palm press, like you're throwing that fireball or whatever you're doing. Palms together, both sides of the legs, and you push forward. Again, both sides. Watch those fingers to the right hand, lift them up, move forward. You can even shake up top because the hips get funky right in here, this junction. Remember, you have your AS, IS, or the AIIS as well. So your inferior iliac spine, then your anterior superior iliac spine, ASIS and AIIS, and it all attaches right here. AIIS, ASIS. For those massage students in school, you're going to pass your test. So after the fireball move, whatever you're going to call it, moving in with both of your palms, use your elbows because you want deeper pressure. So your elbows, you're crossing in and you're adding that weight, your weight, onto them. So deeper pressure, same thing. This hand comes on top of this hand and you really lean in. Now you can do a super deep tissue move to where your hand is up this way, clasping together and really digging in there, but you're going to injure your athlete. If they're injured, their muscles get ripped, they can't perform. You've cost them a contract, you've cost them millions, sponsorships, all that good stuff, a free scholarship, whatever it is. You've messed up the career of that student or athlete. You don't want to do anything too hard, okay? So now we're going to work the inner thigh. So for the inner thigh, we're just going to cradle our client to the side, just like a figure four. If they're happy here, you leave them here. But if they needed support for their legs, you come underneath their ankle, lift the leg up, your leg comes underneath theirs, or your kneecap, and then place it on top. For those athletes who can't go that far in a butterfly motion. But she can, so let's just keep it at this point right now, and then we'll go into the flatter side to where she doesn't need my support. So lotion or cream. And all you're doing is gliding, introducing the cream to the body. So again, remember those thumb strips. Both of those thumbs, what are they going to do? At the kneecap. Patella tendon is on this side, anterior. Now we're just going lateral. The lateral side, your LCL, your lateral cruciate ligaments, right in here, but not too hard because it is sensitive. This whole leg and the inside of the leg is very sensitive. So just take your time. Nice and slow. And so when you're working on that sartorius, the gracilis muscle, abductor magnus, which is that wing muscle, that goes on your femur and actually attaches to 2 parts of your leg. I'm just having a hard time figuring out the other part, but it's a wing-shaped muscle, gracilis or abductor magnus, comes down, and it's almost like a latissimus dorsi muscle for your legs. Like the lats on your back, same thing in your legs. Comes on down, and it hooks back on in. So it's a wing-shaped muscle that allows adduction, to squeeze. Like if you had somebody, UFC fighters or whatever, you have somebody's head in between your legs, and you squeeze. Is those adductor muscles, pectineus, adductor magnus, sartorius, gracilis. And there's one I'm forgetting, but it's all right. So after we just did our stripping, nice and slow, both hands, or you can alternate both thumbs, whatever you want to do. So they want deeper pressure, forearms. You can do your double palms if you want to. I'm pretty sure you already know how to do that, so let's move on into something harder. So you're just rocking in with your elbow. And it's kind of harder to get to this position because her kneecap is going to hit my chest or stomach. So that's why when we go to the next position, I'll show you how easier it is if the client's leg is fully down on the table. So again, forearm. And ask your client, how does that feel? Is it okay, Riley? Okay, good. So say your client can put their leg all the way down in the figure 4 position. Their hips aren't getting in the way, everything is flat. So, forearm, now you can really, really lean without anything hitting you because you're on top of the leg. If that's too much, palms. So you're just palm pressing. And you'll actually start to feel the muscles as long as you go slow and deep, you feel the muscles. But if you go fast, you really don't feel anything but skin. So the slower you go, even underneath my forearms right now, I can feel our muscles, especially the inguinal ligament. I always had a problem pronouncing that, but it's right here. It's the tightest, as well as your sartorius is right here. Because remember that sartorius comes down, crosses over, and hooks into that kneecap. So that's the middle of the leg. Say you want to work on the middle leg, they want a deeper stretch. So off the table, or move them up a little bit further.